Okay, we're live. Audio, please. Audio is good. Hi everyone, good afternoon. Magandang hapon. So this afternoon we have a procedure. This is called a auricular hematoma. This case is a surgical case in a 5-year-old, almost 6-year-old intact ba to? Female mixed breed. It's a 15 kilogram mixed dogs. Based on the owner presented complaint, this dog has a previous conditions, similar conditions, which is auricular hematoma on the left opposite ear. But today, a similar condition happened on the opposite right ear. So this is the hematoma area, okay, on the concave part of the pinna. Oh, this is the auricle external ear. We call this pinna, and this part here is the concave part. There is a swelling there. That means that there is a accumulations of fluids or blood within the skin, between the skin and the cartilage. Okay, so what is auricular hematoma? So it's simply a accumulation of blood on the pinna or auricular or the auricle. The cause of auricular hematoma is mostly associated with I will reverse my camera. Yeah. Ayan. So, ganun natin. Yeah. Okay. So, the etiology or cause of auricular hematoma in dog is a mostly associated with self-inflicted trauma. What does mean is that dog normally shake their heads or scratching due to allergy. There are different types of allergy. As we all know, one of the most common is food, flea bites. There is atopic allergy. Those types of allergy can cause irritation, itchiness, or pruritus, or scratching leads to scratching, head shaking, and that cause inflicted trauma of the ear. So these conditions more common, auricular hematoma, on dogs with long fluffy ear, like this one. This is a basset hound, right? The husk puppy. Okay, pendulous, long, fluffy ear. Because this type of ear, and those breeds of dogs are not easy to clean, and since they are fluffy, and the debris and excretion from the ear are being stuck inside, and it's not being by the ear, so, and cause irritation. Okay, oil glands and some bacteria overgrowth inside the ear canal. Okay. Another problem of ear hematoma, another factor that is considered is there's a report that a hormonal imbalance we call Cushing disease. Because Cushing disease can make the artery or the capillary more fragile. So, normal shaking of the head, scratching will lead to damage or bleeding inside the pinna. the auricle and cause hematoma. Okay? Even there's no allergy, there's no infection, inflammation, all of this condition, all of these factors can lead to hematoma. So, this dog has previous air hematoma on the left side, but was left untreated. So, what happened to the left ear is that it's like nagkaroon siya ng mark scarring, and leads to parang nagkaroon ng deform. There's a deformation of the auricle, external ear. Karoon siya parang like a cauliflower appearance. Okay, so what are the symptoms? So of course, swelling or bulging of the concave part of the air, the pinna, due to blood accumulation. And when you touch that part, there is increased heat. Of course, there's inflammation. Then, when it's left untreated, cause deformation of the ear cartilage, and like in ano, yung mga MMA fighters, ano, due to trauma, it leads the ear like a cauliflower appearance. So, the diagnosis includes blood exams, includes hormonal to check for Cushing disease, and also to check for allergy, because these are the factors that will predispose your dogs for developing auricular hematoma. And also check for ticks and flea, might also cause air mites, cause irritation of the air canal, or maybe otitis. Okay, those are the important things to consider when it comes to diagnosis. So to eliminate, to roll out other possible factors that leads to itchy, inflamed, or pruritic ear. Okay, because the immediate cause is not due to those factors, but the self-infliction. It's due to scratching, that leads to breakage of the small capillaries. Okay, so treatment is, as I've said, this dog has previous history of similar condition, but it was left untreated. So what happened was that deformed the ear. Okay, so if you don't want to happen like what happened to Mimi, is that surgery is needed, because there is no such medications to remove the blood accumulation. So there are different methods of treatment. Aside from treating the underlying cause, which are allergy, there is food, atopic allergy, or any kind of allergy, you have to treat all those underlying problem or primary disease, and also if there's infection, if there is imbalance of the hormone, like Cushing disease, you have to treat all that to prevent recurrence. But for direct treatment to the auricular hematoma, it requires surgery. One, requires simple procedure like some veterinarians opted to perform a, what do you call this, syringe. By using the syringe, they will what we call aspiration, okay, to remove the blood. But as per my experience, I did that before several years ago, but the recurrence rate is high with just aspiration of the blood using syringe. So another treatment method is by the use of tube drain. So some vets will place a tube, a small tube, serve as a drain of the blood, as the blood continues to ooze from that capillary, bleeding capillary, So we continue to hose or to expel blood through the tube. But my technique is not to previous method. I do incisional, but I also modify the technique. So one one method of doing that incisional is to make a simple incision, and it's not sutured back, but the suture can be placed anywhere on the pinna, the side, to just compress the air. But my preference is not just a simple incision, but I will be making holes, at least 2 holes, because there are patients that the whole pinna is swollen, but this time it's about 20% of the pinna is only affected. So I will be making at least 2 holes, or 1 hole, big hole, maybe 1 cm in diameter. So that hole will serve to as drain, no? Then we'll let the wound to heal by second intention. Then after the surgery, we will place some bandaging around the head, around the forehead, so to compress, no, the area on the affected ear, so to squeeze the blood coming out through that hole and to remove blood. So in 2 days, we will remove the bandage. Within 2-3 days, then we will let the patient to go home. Okay, so that's all, and we will start with the surgery. And I hope that for pet owners who have dogs, especially with long, fluffy, pendulous ear, they are more prone to auricular hematoma. Please be guided and visit your veterinarian, your trusted veterinarian, and don't let this happen to your dog. If it happens, surgery is needed. Because if you let this condition heal by its own, because it heals, no? As long as there is no further complication like otitis. So, but the appearance will be not pleasing for you. It goes like, parang nagchichicharon siya. Okay? Thank you, and good day everyone.